Good afternoon, and welcome to our press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost due to COVID-19 and for the families they leave behind. Thank you. Now we will hear updates from our community leaders. And today we'll begin with Chairman Kohelis. I will mention that the mayor is here and present today. He will not be presenting today, but he is here with us, and we appreciate the mayor being present today. Again, I'll say we'll begin with Dougherty County Commission Chair Christopher Kohelis for some comments. Mr. Chair.
Thank you, Chief. Be very direct to the point today and provide some very direct information. We are continuing to see a positive rate of about 18% amongst those that are being tested. We have a pie chart that's up on the screen that demonstrates that. Again, we continue to track this information daily and weekly so that we can make sure that we give you the best up-to-date information possible. I can't say right now that this is a trend, but we are seeing some signs of plateauing following the Christmas holidays. It is too early to actually call that and to say that we are absolutely in a plateau, but we are seeing some early signals of that. And so that is a good sign. I'm not sure if that is going to bear out over the next few days and weeks, but that is very important information. We continue to ask everyone to do what we've been asking all along: social distance, wear masks, keep things clean, make sure that you aren't having large gatherings. Let's continue to wait on the light that is at the end of the tunnel and that is currently infiltrating this community in the form of the vaccine. Again, I'm very, very thankful to the Georgia Department of Public Health and to Phoebe Putnam Memorial Hospital. We have already vaccinated, as I understand it, approximately 10,000 people here in Southwest Georgia. That is remarkably important to our community. It's remarkably important to our state, everywhere. This is very, very important. And in terms of understanding that mathematically, it's a little bit complicated to explain, but we have about 10,000 people that have been vaccinated. I want to say about 1,000 of those have already received both shots of the vaccine. I want to reiterate, we have two different types of vaccine. We have the Pfizer vaccine and the Moderna vaccine. They are both two-shot vaccines. One, I think, is a 21-day vaccine. The other one is 27 or 28. Meaning that you have to take the vaccine on one day, and then 21 days later you take the second shot of the vaccine, kind of like a booster shot, and then the other one you take it on day one, and then 28 days later you take the second one. Important things to understand about this: if you have been vaccinated, that does not mean that you do not wear a mask after being vaccinated. That is a very, very important piece of information. I'm not an epidemiologist. I'm not a doctor. I didn't stay at a Holiday Inn last night and thus qualify myself to give you medical advice. But what I do know is this is what the doctors are telling me. The virus can still reside in your nasal passageways, and you can still reinfect people with the virus, even if you have been vaccinated. Even though the virus itself may not actually impact you or cause you to become sick, you can still transmit it. So these things right here are still very, very important. I want everyone to conceptualize this. We've had a rising infection rate since the Thanksgiving and Christmas holidays. So you had a bunch of people that got infected over turkey dinners at Thanksgiving. okay? That happens. So you had those people, they went out to the community, they infected other people. Then those people, a larger group of people, then went to the Christmas holidays, and they infected more families, more homes, more people, and then they went out to the community. And so it naturally makes sense statistically that that number has continued to rise, not only in our community, in the state, but also in the nation, because these are national holidays that we all know, love, and respect. It's times when we get together with our families, and it happens, okay? It happens, but we have that. We have this this trajectory that's been happening since the Thanksgiving and Christmas holidays. A larger number of people that have gotten infected. We have seen an increase in the death rate. On the other hand, we then have another train that has left the station, which is the vaccine. At some point, these two are going to have to collide. I don't know when that's going to happen. I don't know how that graph is going to look. But what I do know is this. For the first time in almost a year, we actually have an asset that is directly designed to destroy the virus. I'm not an expert on the UK strain. I don't know yet whether or not it truly is amongst us or not. But I do know this. We have a tremendous asset in the form of the vaccine. I again stress to everyone, please, if you're going through the decision-making process relative to the vaccine, talk to medical professionals, read quality information, and do not go to social media for somebody that has no medical opinion, no medical credentials to provide you advice and conspiracy theories on whether or not the vaccine is good for you or good for the community. Again, every single day there's an EMT that gets up, he puts on his shoes, he puts on his uniform, he drives down to Phoebe Health Works where they're vaccinating 650 people every single day. That's happening. It's unprecedented. It's a phenomenal resource for our community. And his job every single day is to make sure that nobody has, if someone does have an immediate and spontaneous allergic reaction to the vaccine, his job is to take care of it. And so far, thus far, we have not had one single one of those allergic reactions that has necessitated emergent medical care. And so I'm not a sponsor. I'm not being paid by Pfizer or Moderna. I don't care which vaccine you get, but it is important to the community. It's important to our citizens. It's important to our elderly. It's important to those that are in long-term care facilities. It's important, frankly, to the families that have buried too many loved ones over the past many months. It's time for us to start winning this marathon and truly putting this behind us. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear from our representative from Phoebe Putnam Memorial Hospital, but before I do, I want to mention we're joined today by Dr. Kathy Hudson, who is the new Chief Medical Officer for Phoebe Putnam Memorial Hospital. Many of you may know her from, she's been in the area quite some time, and just appreciate you being here, Dr. Hudson, with us and taking on this new role. I want to ask them to come up. Also, we have Dr. James Black, who is the chairman of the Emergency Department, and always honored to have you here. And I guess we'll say you have big shoes to fill. We enjoyed being with Dr. Kitchen over this period of time, provided quite a bit of information to our public. And Dr. Hudson, please just welcome to your new position, and all the best to you. Dr. Hudson and Dr. Black.
Thank you so much. If we can put up our slide, and we'll go over our current numbers. As Chairman Cohilas was alluding to, we have seen what we hope will be an indication that we may start to plateau and hopefully see some type of a downturn after the recent holiday periods have caused such a dramatic increase. But just to put it in perspective, nationwide, I believe on yesterday, we had 4,367 deaths nationwide secondary to coronavirus. That is the second highest total we've had. I believe on the 12th, 11th to 12th, it was 4,406. Total for the United States, yesterday's numbers were 406,000. Depending on what source you read, during World War II, we lost either 405,399 servicemen or 407,316. No matter which source you refer to, by the time of this press conference, the number of U.S. deaths will have exceeded the number of people the number of service members we lost during World War II, and that's to a single entity, which is coronavirus. So it is still very present. It is still very deadly. It is not getting appreciably better. If you look at our charts and our census, you will see that across the system, as of this morning, we had 119 coronavirus patients, including 96 at our Phoebe campus. That number is down slightly from a total number of admitted patients, but it's mostly secondary to the number of discharges that we've had. We're still admitting about 11 patients a day, and I think our high water mark was 19 patients were admitted on one day, and a couple of days we've been under 10, but we're averaging about 11 admissions a day. So the number of admissions a day really hasn't gone away. We just had a large amount of decreases that's resulted in a low census. Our ICUs, where our sickest patients go, are still full and still at capacity. That's the way around the state and around the nation. We're still seeing a tremendous amount of coronavirus patients that are not sick enough yet to be admitted to the hospital. So we're seeing them in the emergency department and in the outpatient clinics and discharging them home, but the rate of infection still is quite high. And we heard Chairman Kohelis say that our numbers are down 18% and trending downward, but it's not yet a time to celebrate, and we've not yet made the appreciable decrease that we'd like to see. But if we can sustain these decreases over the next weeks to days, then we may be over this current wave. But it's going to remain to see. The next few days are going to tell us a lot. It's going to be important, though, that we remain vigilant and do those things that we've been talking about. I guess at this moment in time, I'll have Dr. Hudson come up, and she's going to talk a little bit about the vaccinations that are going on and provide information. Dr. Hudson.
Thank you, Dr. Black. Thank you for the warm welcome today. This is my first experience of presenting a press conference, and so I do want to share a little information about the vaccination effort that's ongoing in our community. So we are doing an excellent job of providing resources for vaccinations at Phoebe HealthWorks. Our only concern is the supply of the vaccine to be able to be administered. The state has asked us to endeavor to vaccinate large numbers of individuals, and currently people over this age of 65 and older are being vaccinated at HealthWorks. We're trying to keep up the pace so that we can ensure everyone is vaccinated as long as the supply of vaccines lasts. Currently, we haven't heard when we'll receive a second dose of vaccines. Hopefully we'll hear something again tomorrow, and we'll share that information, but we are not slowing down administering vaccines. So we're not waiting on that second dose, we're just going forward. We really appreciate all the compliments and kind words that everyone has shared with their friends and social media concerning their experience receiving the vaccine at HealthWorks. And it has been a community effort in providing that service. It's not just Phoebe there providing the resources at HealthWorks and in other parts of the area. To date, we have administered 11,563 vaccines in our area. That is including in Americus, Albany, and Sylvester. We'll continue on with that. That's over 1,100 vaccines a day. We're doing, as the state has mandated, the vaccinations are being provided to healthcare workers, first responders, and people 65 and older. When the state expands that criteria, we'll also expand and we'll notify everyone accordingly. And hopefully that will not be, but a few more days, but we don't know. The same with our vaccinations effort. We will keep going to work for this. So I really want to encourage you, if you have not registered for a vaccination and you meet the criteria, please call 229-312-1919, that's 1919. You can download the Phoebe Access mobile app to your phone and go that way and register for your vaccine. It can be anywhere in Americus, Albany, or Sylvester. There are also plans to expand vaccinations to the Phoebe physician primary care clinics and when that information is available, I will share it. There are also some other primary care offices expanding to provide vaccinations. And so the main thing is that until we can all be vaccinated, you know, we're not going to be able to stop this deadly disease. And so I encourage everyone to get their vaccination. Dr. Black was the first at Phoebe. Were you not? He's had both. And I was there an hour or two later. I've had both vaccinations. It's not a terrible experience. We've had very few, even minor reactions. I think the biggest complaint I hear is their arm is sore, and if you've ever had a flu vaccine or a tetanus shot, you also experience that. So I strongly encourage everyone to sign up for a vaccine if they're 65 years of age or older, a first responder, or a healthcare worker. And then when the state expands the process, please sign up as soon as you're available. Thank you.
Thank you, Dr. Hudson. And just to piggyback what you said, I promised that I would keep people updated because, as some of my colleagues said, we're going to wait to see how you do before we make the decision. And I'm 5 weeks out from my first dose and 2 weeks out from my second shot. And I'm still upright, and so is Dr. Hudson, so we're doing fine. You know, I get a lot of emails and a lot of questions, and some of those things are, you know, it was developed too fast. Although it was brought to the public in a fast fashion, it does not mean we don't know what happened. I hear a lot of people say, we don't know what's in it. We know everything that's in the vaccines, okay? This is not some mystery oil that people are trying to administer to us, okay? There are no tracking devices. I've heard that before. So in any case, I'm encouraging everyone to get it. I've had people call me on an individual basis and say, Eddie, you know, should I get the vaccine? And instead of trying to convince people, I can tell you this. I've had the vaccine. My sister, who is also in healthcare, has had the vaccine, and my mom has had the vaccine. And for those of you that know me, know that I love my family to death, and there's no way I would encourage them to do something I thought had a hint of a risk to them. So that's the best endorsement I can give you to please encourage you to get the vaccine. It's one of the new weapons that we have, and we intend to deploy it as much as we can because we've got to stop 4,000 people a day from dying from this disease. Thank you very much.
Thank you for your update from Phoebe Putnam Memorial Hospital. It's always very informative. And again, welcome, Dr. Hudson. I'd like to move now to an update from the Department of Public Health. Dr. Charles Ruiz, who is the director of the Southwest Georgia District, will provide a report. Dr. Ruiz?
Thank you, Chief Scott. Okay, the first thing I want to talk about today is vaccines. The Southwest Georgia Public Health District consists of 14 different counties in Southwest Georgia. And as of close of business today, we will have administered a little over 9,000 vaccines in Southwest Georgia in public health departments. For Daugherty County, as of close of business yesterday, our health department staff had administered 1,347 COVID vaccines. And we are very proud to be partnering with Phoebe Putnam with their vaccine clinic at HealthWorks. We think Phoebe Putnam is doing an outstanding job for the community, and we are delighted to have the opportunity to partner with them. On Tuesdays and Thursdays, we are sending 2 nurses over to Phoebe Works to help vaccinate there. We're pleased to be a part of that. To get a vaccine at the health department, basically it should start with a telephone call to your local health department. We're doing this by appointment only, so please don't just show up with the expectation of getting a flu shot. We do have a call center, but for a variety of reasons, we would prefer that you directly call your health department. When staffing is sufficient, the health department staff will take your call and schedule your appointment. At times, they will be so busy that they can't answer the phones, so those calls in many cases will trip over to the call center line. So for now, if you will please call your health department. At some point in the future, we do believe that the state will develop and roll out a statewide online system. I'll tell you more about that when we get closer to that date. I'd like to switch now and talk about testing. We're really excited in Dougherty County because we have a new opportunity for testing. Going back to March, the health department in Dougherty County has provided free testing. Not every day, but as many days as we could afford to send staff to do the testing. We're excited because now we have an opportunity for testing here in Dougherty County 6 days a week, Monday through Saturday. Now, this is a partnership between the Exchange Club Fair, Public Health, and an organization called MAKO, M-A-K-O. This is an organization that comes out of North Carolina. They are primarily a laboratory, but in recent months, they have extended their services. They've expanded into collection of specimens. So they send teams of people around to different locations where they set up and collect the specimens. The specimens are then delivered to the lab where they are tested for COVID-19. The testing site will be at the Exchange Club Fair, and for those who may not be familiar with the fairgrounds here in Albany, this is on the corner of Oak Ridge Drive and Westover Boulevard. The test that will be performed is the PCR test, the polymerase chain reaction test, and I mention that because this is the gold standard. This is a test that is reliable regardless of whether the test result is positive or negative. I want to stress this test is free of charge. However, when you register for the test, you will be asked to share your insurance information if you have it. Now, that would naturally make you think there's going to be a charge, but there will only be a charge to the insurance company, whether you have insurance or not. You will not be charged. You will not be asked to pay anything. But if you have insurance, MAKO will be able to collect a fee from the insurance company, and that's a good thing for public health because it helps to offset the actual cost of the test. But again, it's free to the patient. Even if you share your insurance information, there will be no cost out of your pocket. And it is very important to pre-register. You won't have an appointment per se. You can go anytime while they're open, and on Monday through Friday, that is 9 a.m. to 4 p.m., and on Saturday, they open at 9 and close at 1 p.m. But it's important to pre-register because if you just show up, it's going to take extra time for them and extra time for you to get registered. And registering is an easy thing to do. One quick way to do it is to go online to southwestgeorgiapublichealth.org. You can just Google Southwest Georgia Public Health and you'll get there. And when you get to the public health page, you'll see a little segment there for MAKO. And for those of you who can see on the screen now, this is what it would look like when you go to the public health page. And it gives the address, it gives the dates and the time, and it gives you two options through which to pre-register. And the easiest one, in my opinion, is to use the QR code. Now, I am in my mid-60s and I am very low tech, but without any assistance whatsoever, I was able to take my cell phone and scan the QR code, and within seconds, it took me to the MAKO site. It was easy to enter the information. It took me less than 2 minutes to pre-register for a test. So I would urge you to consider that option. Another one is going to the MAKO website. You can see it there on the screen. And this afternoon, we plan to put a link there so that you can just click on the link if you would prefer to go to MAKO that way. But no matter which way you choose, it is very important to pre-register. It's going to be better for you and for those who might be in the line behind you. We urge you to do that. Okay, We are at a point in this pandemic where public health could use some assistance. All of our people are spending as many hours a day as possible fighting the pandemic. And we still have other essential duties that we have to attend to. In addition to our full-time staff, we have hired basically an army of temporary workers who are helping with case investigations, contact tracing, testing, and so forth. But we can use more help, especially now that we are in the vaccination stage. We're looking for clinical people. Let's see if I can, well, let me start with this. We're looking for nurses, we're looking for doctors, EMTs, pharmacists, nursing and medical students, that's RNs and LPNs. We could use you to help vaccinate patients. And these are temporary jobs that are paid hourly. And if you are interested in any of these jobs, please go to our website. Again, that's southwestgeorgiapublichealth.org, and there are links there that you can click on, and you'll be taken to a site that has our application. It's easy to apply, and we would love to have you to join us. And it doesn't require a big commitment. If you have one afternoon or one morning a week, or if you have several days, we would love to have you. Whether you are active or semi-retired or retired, if you have an active license, we would love to have you to join us. So if you'll remember, we are still in the thick of things with this pandemic. It is way too soon to claim victory. We all know what to do. We've been told this for almost a year now. Wear a mask, practice social distancing, wash your hands, and by all means, if you are sick, stay home, consult your healthcare provider, get a test. If we'll all do the things that we know to do, we'll help contain this virus. And now that we have the vaccine, if we'll get vaccinated when our time of eligibility comes up, in time, we will control this thing, and life will get closer and closer to normal as we go on. So do what you need to do for yourself, for your family, and for your community. Thank you very much.
Thank you, Dr. Ruiz, for your comments today and update from Public Health. We will now move to have an update from our coroner, Mr. Michael Fowler. Mr. Fowler?
Good afternoon. Today I want to go through a few of my stacks, show you where we at today. We still, I think, in trouble. We still have the virus in our community. So as of today, we have 335. I said the other day, look like we're pushing toward 300. 335 deaths in Dougherty County, residents here in Dougherty County. In the last 6 days, we had 11 deaths. 11 deaths in the last 6 days. By race, you have 59 white, Latino 3, Asian 1. We have 172 blacks. Gender, we have 126 female. We have 109 male. By race and gender, we have 1 Latino female, 2 Latino males. We have 34 white females. We have 25 white males. We have 82 black males, and we have 90 black females. And you can see the middle age is 60. We have 64 in the middle age. So you can see the youngest is in the 20s, we have 2. 30, we have 5. In the age of 40, we have 13. Age of 50, we have 17. Like I said, in the age of 60, we have 64. We have 57 in the age of 70. We have 53 in the 80s, 23 in the age of 90, and 1 in the age of 100. Going back to the stacks, you see how we started out in March, we was 39, went up to 86, and then you saw we came down in that trend, but look at it now. For the month of January, this just the middle of January, we got 21 already. I mean, we going back up. Last month we had 14. We had got down to 4. Then we went up to 14 after the holidays, during the Thanksgiving and the Christmas holidays, started going back up. Now after the New Year's, we got 21 already this month. I want to piggyback on this a little bit and close. Wearing masks. I go to many functions, games, churches, and places like this, and I want to show you the importance of wearing the mask right. You see the way to wear the mask. You cannot wear your mask up under your chin. You cannot wear it just on your mouth. You're still able to inhale and exhale. So those the wrong way to wear the mask. What's the purpose of wearing the mask? You still can inhale the virus. The proper way of wearing the mask, you got to have it on your nose and you got to have it on your mouth together. You can't have the mask just hanging around your neck when you go into the store or just up under your chin. Somebody say, I just can't breathe. I'd rather try to breathe with this mask on than to breathe with COVID. So I want to say, if you're going to wear the mask, wear it right, because you can contaminate other individuals and you can mess around and catch the virus yourself by not wearing the mask. So I encourage you, as everyone has said before, you got to mask up. I want to say thank you.
Thank you, Mr. Fowler. We will pause here for any questions that anyone may have today. Please.
I was wondering if Dr. Hudson could talk about how long it takes for the vaccine to reach 95% effectiveness.
Yes. Okay. Dr. Hudson.
The question is how long does it take the vaccine to become effective? And so the vaccine, the first dose, is estimated at 65% effective. So after the second dose, they're talking 95% effective. Now that doesn't mean that you still can't get COVID. There's that 5%. So if you've had the vaccine, you still need to do the 3 W's. Wear a mask, wash your hands, and watch your distance, because that's going to be important. The vaccine will not be 100% protection. It's not a suit of armor, so it's very important to always wear a mask. Mr. Fowler just demonstrated the correct way to wear a mask, and so that's really that protects you and it protects others. So, any other questions? No? Thank you.
One moment, Mr. Fowler, if you could, please come on up so that you can be seen and heard.
Yes, ma'am.
This was just a clarification question. During your presentation, you said there have been 335 deaths. I just wanted to clarify. You didn't
235. And what I was saying, we pushing toward 300. Last week I was saying, before November, I was saying I hope we don't go head toward 300. A few months ago, I was saying I hope we don't get 200. But you see now we heading toward 300. So we got 235, we got 21 deaths just in January. So I don't know how many we're going to end up in January. And then February, like I said, that's very important. We got to wear our masks. We got to keep doing what the scientists have already told us to do. Thank you now.
Okay. Any other questions? Okay. We will conclude our press conference here for today. We will return in our regular scheduled time, which will be Friday at 10 a.m. So we'll be back next Friday at 10 a.m. And of course, we've gone to weekly press briefings. With that, that will conclude our time together today. Stay safe, Albany, Dougherty County.